Dr. Noble, can you tell us a little bit about yourself and your expertise?
Yeah. First thing I'd say about myself is I prefer you to call me Simon.
Okay.
We're on the same side here. We're all doing the same thing. What is there to tell? I'm a palliative care physician, so I do supportive care for people with advanced cancer and advanced non-malignant disease.
Okay.
And what I found was many of my patients had blood clots, especially those with cancer. And over the years, I've developed that as an interest, both clinically and with research. So now I work in Cardiff University, where I do a lot of cancer-associated thrombosis research, but I've also set up a cancer-associated thrombosis service. So I see all the new cases in South East Wales, about 305 new patients a year.
Wow.
And we will look after them from diagnosis to the end of that thrombosis journey, wherever it leads.
Wow, that's incredible. So I understand that your focus on cancer-related thrombosis and your research has been to understand the gaps, if there are any, concerning the healthcare for these patients.
Yeah, we've been doing a series of studies called PELICAN, which stands for Patient Experience of Living with Cancer-Associated Thrombosis. And the thing that led to this, believe it or not, was that 19 years ago I was a cancer patient and I received treatment for cancer. I was cured, thank goodness. But what I recognised was that as a patient, things that were important to me may not necessarily have been important to the doctor.
Absolutely.
So we did the PELICAN study to try and understand what it was like to be a patient with cancer-associated thrombosis. Because as I've said, we know how to manage the clot biochemically really well.
Absolutely.
So what we did is we interviewed patients who had had cancer-associated thrombosis and just said, tell me about your experience. And we listened. And those interviews we recorded, we wrote them down, and then using something called qualitative analysis, we looked at their experiences, and wherever we saw there were things where there was a commonality, where they all had the same experience, that would be what we called a theme.
Yep.
And we could see very clearly certain things that all the patients said.
Simon, can you please tell us what inspired you to do this research?
I think first of all the patients, because I was seeing a lot of patients who were presenting with clear information needs, support needs,
Of course.
which the current system hadn't addressed. And I'd also had an experience myself as a patient. 18, 19 years ago I was treated for cancer, and I realised during that time that sometimes what was important to me was not necessarily important to the doctors.
Yeah.
The doctors were spending their time, quite rightly, keeping me alive, curing cancer. But the thing that stopped me getting out of bed would be my bowels, for example, constipation. I couldn't face the world because of that. And I'd say to the doctor, can we do something about this constipation? It's terrible. And he'd say, well, yeah, but look, mate, we're curing cancer here. It's going to be tough.
Of course.
So I wanted to actually see the cancer-associated thrombosis journey through the eyes of a patient. I could see it as a doctor, I could see the biology, I could see the scans, I could see how the drugs worked, but I couldn't see what it was like to be the person living with cancer-associated thrombosis.
Helping to bridge that gap together.
And it was a big gap, but we're narrowing it now.
That's fantastic. Thank you for sharing.
Cool.